What if I told you that you could walk out of your annual physical with a clean bill of health, every box checked, every number normal, and still be walking toward a heart attack, nerve damage, or early cognitive decline that could have been prevented? That the standard blood panel your doctor runs covers only the tip of the iceberg, while the real threats swim silently beneath the surface. Every year, millions of people get their blood drawn, hear everything looks fine, and go home reassured. But here's the shocking truth. The most dangerous health conditions often develop for years before they show up on a routine CBC or basic metabolic panel. And by the time they do, the window for easy early intervention may have already closed. I'm Dr. Leonid Kim, and today I'm revealing the 5 critical blood tests that almost nobody gets, but everybody should. These aren't exotic, expensive panels reserved for the wealthy. They're accessible, affordable, and potentially life-saving. By the end of this video, you'll know exactly what to ask your doctor for at your next appointment. Let's get into it. Here's what most people don't realize. There's a massive difference between normal and optimal when it comes to blood tests. Normal just means you're not sick enough to need medication yet. Optimal means your body is functioning at its peak. Think of it like the oil pressure gauge in your car. The normal range might be anywhere from 20 to 60 psi. But if your engine runs best at 50 and you're hovering at 22, you're technically normal, but your engine is wearing down faster than it should. You won't break down today, but you're accelerating toward a problem. Your body works the same way. Lab reference ranges are often based on population averages, not on what's ideal for longevity, energy, brain health, or disease prevention. They're designed to catch disease, not to optimize health. But this is where it gets interesting. The standard annual physical typically includes a complete blood count, CBC, a basic metabolic panel, maybe a lipid panel if you're lucky, and sometimes a TSH for thyroid. That's it. Meanwhile, chronic inflammation, insulin resistance, nutrient deficiencies, and early cardiovascular damage can be raging undetected. Most people get this wrong. They assume that if their doctor didn't order a test, it must not matter. But the reality is that doctors are constrained by insurance guidelines, time pressures, and the medical system's focus on treating sickness rather than preventing it. The tests that catch problems early, before they become diseases, often fall through the cracks. Here's the surprising part. All 5 tests I'm about to share cost less combined than most people spend on coffee in a month. They're not hidden behind special access or exclusive clinics. You just need to know to ask for them. This changes everything about how you approach your health. Let's start with a test that measures something you can't feel, can't see, and probably never think about. But that drives more chronic disease than almost anything else. High-sensitivity C-reactive protein, or hsCRP, measures low-grade inflammation in your body, not the kind of inflammation you feel when you sprain your ankle. I'm talking about the silent, smoldering, chronic inflammation that burns inside your blood vessels, your joints, your brain, and your organs, day after day, year after year. Remember how I describe inflammation? It's like an internal fire. Small, controlled fires are necessary for healing. But when that fire never goes out, it damages everything it touches. Heart disease, diabetes, Alzheimer's, depression, autoimmune conditions, even accelerated aging itself. Chronic inflammation is the common thread. Here's what most people don't realize. You can have completely normal cholesterol, normal blood pressure, and normal blood sugar, and still be at high risk for a heart attack if your hsCRP is elevated. In fact, some cardiologists argue that hsCRP is a better predictor of cardiovascular events than LDL cholesterol. Let me explain why using a simple analogy. Imagine your arteries are pipes carrying water. Cholesterol is like debris floating in that water, but inflammation is what makes the pipe walls rough and sticky. Without inflammation, cholesterol slides past harmlessly. With inflammation, cholesterol clings to the walls, builds up, and eventually blocks the flow. Inflammation is the trigger. Cholesterol is the fuel. hsCRP tells you how much trigger you have. But this is where it gets really interesting. Research from the landmark Jupiter trial found that people with elevated hsCRP but normal cholesterol had their cardiovascular risk cut in half when inflammation was reduced, even though their cholesterol didn't change significantly. This means inflammation isn't just a bystander, It's a causal driver of heart disease. Here's the surprising part. HSCRP can also predict risk for type 2 diabetes, depression, and dementia, independent of other risk factors. One study found that people in the highest HSCRP quartile had a 2.3 times greater risk of developing depression over the following decade. Your inflammatory status literally affects your brain. Most people get this wrong. They obsess over their cholesterol numbers while completely ignoring inflammation. But you need to know both. Cholesterol without inflammation context is like knowing the fuel level without knowing if there's a spark. What to ask for HS-CRP? Optimal is under 1.0 milligrams per liter. Between 1.0 and 3.0 is moderate risk. Above 3.0 is high risk and demands attention. How to lower it? Anti-inflammatory diet, omega-3s, colorful vegetables, spices like turmeric, regular exercise, adequate sleep, stress management, and addressing hidden infections or gut issues. Now, let's talk about the test that could save you from diabetes, years before your blood sugar ever rises. When most people think of diabetes testing, they think of fasting glucose or HbA1c. But here's what most people don't realize. By the time your fasting glucose is elevated, you've already lost up to 50% of your beta cell function. The insulin-producing cells in your pancreas have been struggling for years. The damage is already significant. Fasting insulin and the HOMA-IR score, a calculation based on fasting insulin and fasting glucose, catch the problem years earlier when it's still reversible. Let me explain the mechanism simply. Insulin is the hormone that escorts glucose from your bloodstream into your cells where it's used for energy. Think of insulin as the key that unlocks the door to your cells. In a healthy person, a small amount of insulin opens the door easily. Glucose flows in. Energy is produced. Everyone's happy. In insulin resistance, the locks get rusty. The keys don't work as well. Your pancreas has to produce more insulin to achieve the same effect. Your fasting insulin levels rise. Your cells become increasingly deaf to insulin signals. This is the silent precursor to type 2 diabetes. But this is where it gets interesting. For years, your pancreas compensates by pumping out more and more insulin. Your blood sugar stays normal because the extra insulin is still doing the job, barely. But the strain on your pancreas is enormous. Eventually, the beta cells start to burn out. They can't keep up. And suddenly, your blood sugar spikes. You're diagnosed with diabetes. But the process started a decade ago. Think of it like a dam. For years, water pressure builds behind the wall. The dam holds. Everything looks fine from downstream. But the structural stress is accumulating. One day, the wall cracks. The flood comes. But the problem didn't start that day. It started years earlier. Fasting insulin is the pressure gauge behind the dam. It tells you the stress is building long before the wall breaks. Here's the surprising part. Elevated fasting insulin is also linked to weight gain resistance, polycystic ovary syndrome, PCOS, non-alcoholic fatty liver disease, and even certain cancers. It's not just about diabetes. It's about metabolic health across your entire body. Most people get this wrong. They wait for their glucose to rise before taking action. But glucose is the late warning. Insulin is the early warning. If you only check glucose, you're flying blind until the plane is already going down. What to ask for? Fasting insulin and fasting glucose. From these, calculate HOMA-IR. Optimal fasting insulin is under 5 micro-IU per milliliter. Some functional medicine practitioners say under 3. HOMA-IR should ideally be under 1.0. How to improve it? Reduce refined carbohydrates and sugar, increase fiber and protein, practice time-restricted eating, build muscle through resistance training, prioritize sleep, and consider supplements like berberine or inositol under medical guidance. If you've ever complained of fatigue, weight gain, hair loss, or brain fog to your doctor, they probably ordered a TSH test and called it a day. If TSH was normal, they told you your thyroid was fine and sent you on your way. But here's what most people don't realize. TSH alone tells you almost nothing about how your thyroid is actually functioning. It's like checking the thermostat in your house and assuming the furnace, the ductwork, and every room's temperature are all perfect. TSH, thyroid-stimulating hormone, is produced by your pituitary gland. It tells your thyroid to make hormones. But it doesn't tell you how much thyroid hormone your thyroid is actually producing, T4. How much active hormone is reaching your cells, T3, whether your body is converting T4 to T3 properly, whether autoimmune antibodies are attacking your thyroid, but this is where it gets really interesting. The The standard TSH reference range is 0.5 to 4.5 milli-international units per liter, a range so broad that it catches almost nobody. Yet many people feel symptomatic when TSH is above 2.5, especially if they also have low T3. The normal range includes people with subclinical hypothyroidism who are suffering daily but being told they're fine. Think of TSH as the boss yelling at the worker. If the boss is yelling louder and louder, higher TSH, it means the worker isn't getting the job done. But to really understand the problem, you need to look at the worker's output, T4 and T3, and whether anything is blocking the delivery. Here's the surprising part. Up to 20% of women and 10% of men have some degree of thyroid dysfunction, and many are undiagnosed because only TSH was checked. Meanwhile, they're taking antidepressants for their mood, stimulants for their fatigue, and hair treatments for their thinning, never knowing the root cause. Most people get this wrong. They accept a normal TSH as proof that their thyroid is fine, even when every symptom screams otherwise. But thyroid health is complex. You need the full picture. What to ask for: a complete thyroid panel including TSH, but interpreted in context; free T4, the storage hormone your thyroid produces; free T3, the active hormone your cells actually use; reverse T3, the inactive form that can block T3; thyroid antibodies, TPOAB and TGAB, to catch autoimmune Hashimoto's thyroiditis. Optimal ranges are tighter than standard lab ranges. Many functional practitioners aim for TSH between 1.0 and 2.0, free T4 in the upper half of the reference range, and free T3 in the upper quarter. How to support thyroid health: ensure adequate iodine, selenium, zinc, and iron. Manage stress. Cortisol suppresses TSH. Address gut health. Consider working with a practitioner who understands optimal ranges, not just normal. Vitamin D isn't really a vitamin. It's a hormone that regulates over 1,000 genes in your body. And yet, the standard testing and interpretation of vitamin D is shockingly inadequate. Here's what most people don't realize. The reference range for vitamin D is typically 30 to 100 nanograms per milliliter. But research on optimal health, immune function, and disease prevention suggests that 40 to 60 nanograms per milliliter is where the real benefits live. At 30, you're not rickets level deficient, but you're far from optimal. Think of it like this: the minimum wage keeps you from starving, but it doesn't let you thrive. A vitamin D level of 30 keeps you from bone disease, but it doesn't give you the immune protection, mood regulation, cardiovascular benefits, or cancer risk reduction that higher levels provide. But this is where it gets interesting. Vitamin D is a master regulator of your immune system. It modulates the balance between pro-inflammatory and anti-inflammatory responses. It enhances your body's ability to fight infections. It supports cardiovascular health by regulating blood pressure and reducing arterial stiffness. It plays a role in insulin sensitivity, and it's deeply involved in mood regulation. Low vitamin D is consistently linked to depression. Here's the mechanism. Simply, vitamin D binds to receptors on immune cells and tells them how to behave. When levels are optimal, your immune system is like a well-trained security force, responsive but disciplined. When levels are low, your immune system becomes either too sluggish, increasing infection risk, or too aggressive, increasing autoimmune risk. Think of vitamin D as the conductor of your immune orchestra. Without a strong conductor, the musicians play out of tune. Some too loud, some too quiet, some not playing at all. Here's the surprising part. A meta-analysis published in the British Medical Journal found that vitamin D supplementation reduced the risk of acute respiratory infections by about 12% overall, but by 70% in people who were profoundly deficient at baseline. The lower your starting level, the more dramatic the benefit of correction. Most people get this wrong. They assume that because they spend time outdoors or take a multivitamin, their vitamin D must be fine. But vitamin D synthesis from sun exposure depends on latitude, skin tone, age, sunscreen use, and time of day. And most multivitamins contain a token 400 to 800 IU, often insufficient to correct deficiency. This changes everything. You need to test, not guess. And you need to aim for optimal, not just not deficient. What to ask for: 25 hydroxyvitamin D, 25 OHD. Optimal range: 40 to 60 nanograms per milliliter, 100 to 150 nanomoles per liter. Below 30 is deficient. Above 100 may increase risk of hypercalcemia in some people. How to optimize: safe sun exposure, 10 to 30 minutes midday depending on skin tone, Vitamin D3 supplementation, typically 2,000 to 5,000 IU daily for maintenance, higher doses for deficiency, work with a practitioner, and always pair with vitamin K2 to direct calcium to bones rather than arteries. The final test on our list is one that especially affects women. But men can be affected too, and almost nobody gets the full picture. When doctors suspect iron deficiency, they typically order a CBC and look at hemoglobin. If hemoglobin is normal, they conclude your iron is fine. But here's what most people don't realize. You can have normal hemoglobin and be severely iron deficient. Let me explain why. Hemoglobin is the protein in red blood cells that carries oxygen. Iron is a key component of hemoglobin, but your body prioritizes keeping hemoglobin normal at almost any cost. It will pull iron from your tissues, your muscles, your brain, and your immune system to maintain hemoglobin levels. So hemoglobin is the last thing to drop in iron deficiency. By the time it's low, you've been deficient for a long time. Think of hemoglobin as the visible tip of the iceberg. The real mass of the problem, the tissue iron depletion, the ferritin depletion, the functional iron deficiency, is hidden beneath the surface. But this is where it gets really interesting. Iron deficiency without anemia, called iron deficiency without anemia, IDWA, or iron deficiency with normal hemoglobin, is incredibly common and causes profound symptoms: crushing fatigue, brain fog, hair loss, brittle nails, restless legs, poor exercise tolerance, and weakened immune function. Yet it's routinely missed because only hemoglobin was checked. Here's the mechanism. Iron is essential for mitochondrial function, the energy production in every cell. It's required for neurotransmitter synthesis, including dopamine, which affects motivation and focus. It's needed for thyroid hormone conversion, T4 to T3. It's critical for immune cell function. And it's necessary for muscle oxygen utilization. When iron is depleted at the tissue level, every one of these systems suffers, even while your hemoglobin looks perfectly fine. Here's the surprising part. Studies estimate that up to 20% of menstruating women have iron deficiency without anemia. Among female athletes, the number can be as high as 35%. These women are told their blood work is normal while they're experiencing debilitating fatigue, hair falling out in clumps, and workouts that feel impossible. Most people get this wrong. They accept a normal hemoglobin as proof of healthy iron status. But hemoglobin is a lagging indicator. Ferritin, your iron storage protein, is the leading indicator. And you need to see the full panel to understand the real story. What to ask for? A complete iron panel including serum iron, iron circulating in blood, total iron binding capacity, TIBC, how much iron your blood can carry, transferrin saturation, percentage of transferrin carrying iron, ferritin, your iron stores, the most important marker. Optimal ferritin is debated, but many functional practitioners aim for 70 to 100 nanograms per milliliter for women and 100 to 150 nanograms per milliliter for men. Below 30 is generally considered deficient even if hemoglobin is normal. How to improve it? Iron-rich foods, red meat, liver, shellfish, spinach. Vitamin C with iron meals to enhance absorption. Avoid tea and coffee around iron-rich meals, tannins inhibit absorption, and consider iron supplementation if deficient, but only under medical supervision, as excess iron is toxic. Now, let me zoom out and tell you why these 5 tests together paint a picture that no single test can capture. These 5 markers, inflammation, insulin sensitivity, thyroid function, vitamin D status, and iron status, are the foundation of metabolic and immune health. They influence each other, they cascade into each other, and when even one is off, it can drag the others down with it. High insulin drives inflammation. Inflammation suppresses thyroid conversion. Low thyroid reduces vitamin D activation. Low vitamin D impairs insulin sensitivity. Low iron reduces thyroid hormone production. It's a web of interconnection, and these 5 tests are the nodes that reveal the most. Think of your health as a symphony orchestra. The HSCRP is the percussion, setting the rhythm and intensity. Fasting insulin is the brass section, powerful and driving. Thyroid is the strings, providing the melody and harmony. Vitamin D is the woodwinds, adding color and modulation. Iron is the conductor's baton, coordinating the energy and timing. When all sections play in tune, the music is beautiful. When even one section is off, the whole performance suffers. Most people get this wrong. They treat health as a collection of isolated parts. My cholesterol is fine. My blood sugar is normal. But health isn't a checklist. It's an ecosystem. These 5 tests give you a window into that ecosystem. Here's what changes everything. Catching dysfunction in these 5 areas early, when numbers are suboptimal but not yet diseased, gives you the power to intervene with lifestyle, nutrition, and targeted supplementation. You're not waiting for disease to arrive. You're preventing it from ever knocking on the door. All right, so you want these tests. How do you actually get them? Option 1, ask your doctor. Bring this video to your appointment. Tell them you want a more comprehensive look at your metabolic and inflammatory health. Some doctors are receptive, especially if you explain your symptoms. Others may resist because insurance doesn't always cover optimal screening. Option 2, order them yourself. In many countries, including the US, you can order your own blood tests through direct-to-consumer labs. Companies like Ulta Lab Tests, Walk-in Lab, and others offer these panels without a doctor's order. You'll pay out of pocket, but the cost is often surprisingly reasonable. Option 3. Work with a functional medicine practitioner. These practitioners typically run more comprehensive testing and interpret results through the lens of optimal ranges rather than just disease ranges. Now, the common mistakes: getting tested once and never again. These markers change. I recommend retesting every 6 to 12 months. More frequently if you're actively working to correct a deficiency or imbalance. Focusing on one test and ignoring the others. These 5 tests work together. A complete picture requires all of them. Chasing numbers without addressing root causes. If your HSCRP is high, don't just take anti-inflammatory supplements. Ask why. Poor diet, hidden infection, chronic stress, gut dysbiosis. Comparing your results to normal ranges instead of optimal ranges. Remember, normal just means not diseased. Optimal means thriving. Waiting for symptoms before testing. By the time you feel sick, dysfunction has been building for years. These tests are preventive tools, not just diagnostic ones. Let me clear up some confusion. Myth: if my doctor didn't order it, I don't need it. Fact: doctors are constrained by insurance, time, and standard protocols. Preventive optimal health testing often falls outside these constraints. You are your own best advocate. Myth: these tests are too expensive. Fact: many direct-to-consumer labs offer these 5 tests as a bundle for under $200. That's less than most people spend on streaming services in a year. Your health is worth the investment. Myth: normal blood tests mean I'm healthy. Fact: normal means not yet diseased by conventional standards. Optimal means functioning at your peak. There's a massive gap between the two. Myth: I feel fine, so I don't need testing. Fact: many of the conditions these tests catch, insulin resistance, subclinical hypothyroidism, iron deficiency without anemia, cause few or no symptoms in early stages. Testing before symptoms appear is the definition of prevention. Let me leave you with this. Your body is constantly sending signals. Some are loud: pain, fatigue, obvious illness. Others are silent: slowly rising inflammation, creeping insulin resistance, depleting iron stores, fading thyroid function. The silent signals are the dangerous ones because by the time they become loud, the damage may be done. These 5 tests, HSCRP, fasting insulin with HOMAIR, a complete thyroid panel, vitamin D with optimal targets, and a full iron panel are your early warning system. They're the smoke detectors that beep before the house burns down. They're the pressure gauges that show stress before the pipe bursts. We've covered 5 critical insights today. The inflammation fire you can't feel, the insulin resistance hiding behind normal blood sugar, the thyroid dysfunction missed by TSH alone, the vitamin D gap between not deficient and optimal, and the iron depletion that normal hemoglobin conceals. Together, they form a blueprint for understanding your body at a level that standard physicals simply don't reach. Most people get this wrong. They wait for disease to arrive before they take their health seriously. They react instead of prevent. They treat instead of optimize. But the most powerful medicine isn't a pill. It's knowledge. It's catching dysfunction early. It's making informed choices before crisis forces your hand. Here's my challenge to you. At your next doctor's appointment, bring up these 5 tests. If your doctor won't order them yourself. Know your numbers. Track them over time. Use them as guideposts for the lifestyle choices that will keep you healthy for decades. If this video empowered you to take control of your health, hit that like button. It tells YouTube that preventive health education deserves a bigger audience. Subscribe to my channel for more deep dives where I decode the science behind optimal health and disease prevention. And drop a comment. Which of these tests have you had? Which one surprised you? Let's start a conversation. Your blood doesn't lie. It tells the truth about what's happening inside you if you know how to listen. Start listening today. I'm Dr. Leonid Kim. Take care of your health.